December 16th.
As New York City gets ready to distribute up to 500,000 doses of the coronavirus vaccine, officials admit they've got a number of obstacles to overcome.
And one of the biggest hurdles? Convincing people to actually get it. CBS 2's political reporter Marcia Kramer has the story.
First, the good news. New York City expects to get a healthy dose of the first shipment of COVID vaccine.
We expect the first shipments as early as December 15th. That is 12 days from now.
Now the tough part, convincing skeptical New Yorkers that the vaccine is safe and effective.
The process of turning a vaccine into a vaccination will be a challenge. Public trust in the vaccine is essential.
Polls have shown the public is skeptical. 62% of adults say they're worried that White House pressure forced the FDA to approve the vaccine before it was determined to be safe and effective. Only 51% in another poll said they would get the vaccine, 72% citing uncertainty about effectiveness. Mayor de Blasio was asked if the city had a contingency plan for how to distribute the leftover doses if people balk at getting the vaccine.
I don't think we're going to have a leftover problem. I think we can say that. I think there's going to be, honestly, tremendous need, tremendous interest.
But while the city says it's well on its way to developing plans to distribute the vaccine fairly, including to the 27 communities hardest hit, there's some confusion as to exactly how many doses New York City will have available. The city says it will get over 465,000 doses this month, over 250,000 from Pfizer on December 15th, over 211,000 from Moderna on December 22nd. The state says it will get 170,000 doses from Pfizer on December 15th and another 170,000 doses 21 days later for the second dose that's required. Vaccine distribution is handled by the state. All this comes as black leaders in New York City formed a task force to make sure the vaccine is readily available in the minority community. We want to identify with specificity those NYC community rooms, churches, mosques, and other places our people go, so we don't have to drive in a car. We don't have to go to a Walgreens to get a vaccine, said the Reverend Al Sharpton. Meanwhile, health officials are expressing another concern, the problem of making sure people return for the required second dose. A spokesman for the mayor told me that New Yorkers should know that we will only distribute a vaccine that we have incredible confidence in. I'm Marcia Kramer, CBS 2 News.